What is the borderline or gray zone between clonal hematopoiesis with cytopenia, which would be CCUS, and early MDS? And actually it's more a gray zone than a borderline, because really the diagnostic criterion at the moment is presence of significant dysplasia on morphological examination. If you have that, plus cytopenias, then you have MDS. If you just have cytopenias and the gene mutation but no significant dysplasia, you have clonal cytopenia of uncertain significance. And we all know, those of us who do cytomorphology especially, that defining dysplasia on morphologic examination can sometimes be tricky, and it's certainly observer dependent. So if you have the same patient observed or evaluated at different institutions, I'm pretty sure you're sometimes going to get discrepant results, and one expert is going to classify them as pre-MDS CCUS, and another expert is going to say, oh, this is low-risk MDS. How can we potentially solve this? Well, one approach could be to integrate additional criteria, such as, for example, flow cytometric measures of dysplasia, or even, again, AI-based approaches, automated image processing, which may give us a more objective assessment of morphologic dysplasia. On the other hand, we're already seeing studies that treat patients with clonal cytopenia with therapies that are similar to those that we could also use in low-risk MDS. So maybe in the end, we're actually gonna treat these conditions as a continuum, and we're rather gonna focus our treatment or care strategy on the manifestation, which is the cytopenia and the genetics, and put the distinction of CCUS versus MDS rather in the background and say, well, if a patient has clonal cytopenia and they're symptomatic and they respond to the same treatment that a low-risk MDS patient would respond to, maybe the distinction is not all that relevant anymore. Quite similar to what we're seeing at the other end of the MDS spectrum between MDS and AML, where the ICC classification actually introduced that new category of MDS-AML to address a very similar borderline zone where often it's difficult to assign patients to one or the other.